Well, I think being a physician actually is a real pleasure and something I enjoy doing. I think it's a privilege for people to be able to put their trust in you to take care of them. And my philosophy is to try to do the best job I can of giving them the best care they can possibly obtain. I did my undergraduate work at the University of Mississippi and went here to medical school at the University of Mississippi Medical Center. I then went to Yale, where I did an internship and residency in internal medicine. I had a short break of 2 years in the service where I worked at the Atomic Bomb Casualty Commission in Hiroshima, Japan. And then I returned to the University of Alabama in Birmingham, where I did my cardiology training. I am from Jackson originally, so this is home, and I was interested in coming back to this area. I came back initially and ran the heart cath lab at the University of Mississippi Medical Center. At that time, though, there was not a heart program in the state of Mississippi that gave complete care, in the sense that most of our residents were going out of state to have heart surgery done. And at that time, Dr. Kilgore approached me about coming to the Baptist Medical Center and starting a heart program, with me doing the heart catheterizations and he doing the surgery. And we started that in 1971, and I directed the heart cath lab. Dr. Kilgore did the surgery, and I have been here ever since. The first patient we did here was a patient with pulmonary stenosis, but the second patient was coronary bypass, and coronary bypass has been the predominant operation just because that's where most people have the problems. Early on, we had a team that was Ralph Dunn, who did the anesthesiology, and Dr. Kilgore and I, and we had visited the Mayo Clinic and we'd visited Denton Cooley, and then came back and prepared to start the program here. And from day one, it was extremely busy. One of the early problems we had was that Dr. Kilgore couldn't get in the operating room till late, but fortunately the surgeons early on agreed to let the cardiovascular surgeons have their own operating room, and that way the critically ill patients could be taken care of quickly. The results were excellent, in the sense that across the country, the best results in coronary bypass was a mortality of about 1%, and Dr. Kilgore was in that range and did work that was comparable to any place in the country. In fact, we even had patients going to see Denton Cooley that Dr. Cooley told them they could get just as good an operation here as they could if they came out there to see him. At the time of Dr. Kilgore's retirement, in fact, I presented an abstract that we sent to the American Heart Association back early on, where we presented the data from here with a 1% mortality with coronary bypass, and also calculated the cost of doing surgery in a private hospital. And the paper was rejected because they felt that you couldn't get that good of results in a private hospital, and no one was interested in the cost of medicine at that time. So times have changed a great deal since then. Well, one of the things that at my stage in life that's a real pleasure, I've been taking care of many patients for 20 and 30 years. And I've taken care of them for so long, I really don't even consider them patients. I think of them as friends, and it's been a real pleasure, and there's nothing nicer than to see an old friend once a year, to check them up and see that they're doing well, and that hopefully I have been helpful in that process.